Dr. Allen. I know you're here for concerns about COVID testing. My understanding is that you work in a healthcare environment, potentially a doctor's office, and with some possible exposure to a COVID-19 coronavirus positive patient. Can you tell me, have you had any symptoms?
As of right now, no. I just woke up 2 days ago with a cough, mild cough, no fevers. That's it.
And have you had any fevers or temperature?
No fevers, just like she's a sore throat, and that's it.
Okay. I do understand that you are pregnant.
Correct, 30 weeks.
30 weeks. Have you had any abnormalities associated with the baby?
As of right now, no.
No. Good deal. Can you give us an idea of when the exposure was and what happened with that exposure?
Yes, so on Monday, I believe it was the 16th of March, a patient came into the front window stating that she was here to pick up a lab work to test for COVID because she was exposed by a bartender, and we sent her on her way, and the patient came back stating a couple, I'm going to say hours later, not 100% sure of the time frame, that the lab was not testing for that. So we went to give her another lab slip, and we sent her on her way. On Wednesday, the 18th of March, I got a phone call and answered the phone call stating that patient called saying, oh, I just want to let you guys know that I tested positive for COVID.
Well, she did go through the health department to get tested, and she went back positive on Wednesday.
So we're understanding that the health department did confirm that the lady was positive?
Correct.
Okay.
I believe she came in with all the symptoms, that she had fever, cough, sore throat, all the symptoms. We let our doctor know that works at the clinic, our doctor, and he said that to not call public health, that he was going to speak to his boss, I believe so. And that's when I felt a little bit isolated and, in a sense, backstabbed, because we should have been making sure that this was not a positive COVID to his employees, because we
should have been sent out for testing
immediately. The other concern was, since I live with my family, it was a bit of anxiety going home that day, and I was thinking about not even going home, because I didn't know if I actually had it or if I didn't, because
we weren't being sent to get
they
tested.
weren't
We
being
just felt
sent to get
isolated.
tested. So they just
We
said,
felt nice.
I mean, you gotta deal with it your own, basically how we felt. They didn't give us any resources. They said, no, you're not gonna get tested, you don't have any symptoms, but yet we came very close to a patient that had the coronavirus. So we were just dealing with a lot of anxiety, and we weren't reassured about anything, and it was just very nerve-wracking till this day, actually.
How long has the exposure been?
Since
Monday, so about 6 days.
6 days.
5,
Okay.
6 days.
Well, I do want to say this. Even though you have not had symptoms, it's clearly in 14 days.
Correct.
They talk about if any symptoms develop in 14 days after contact with a person who has the coronavirus, you must be tested. Even though the indications may not be now, we're only 6 days into it. So I want to be clear, you are not out of the woodworks.
Correct.
You are not done with this. After 14 days, according to the criteria, it's when you can feel safe. And I'm glad that you're able to speak out, because you should be evaluated. It's still within the 14 days, even though there's no symptoms. I want you to know this facility is here for you. I want to test you now. I'm going to give that time frame as available. And if necessary, I will test you without a problem. You have not met the true criteria yet. And the reason they're just not testing, because there's not that many tests available at this time. They are getting better. But clearly you do have one of the CDC requirements, an indication for positive testing of the coronavirus. We want to address with this segment is the misunderstanding or ostracizing possible healthcare workers if there is an evidence of exposure to a person who test positive or have deposited coronavirus. An initial evaluation, irrespective of fever, is definitely inappropriate. Is appropriate if there was exposed to someone at the job. But the idea is to let the public know we must address the concerns of our workers. We must address the concerns of any employee who may be pregnant or is truly pregnant. And we must stand together and not say things such as don't notify anyone. When it's a time of crisis, we must stand up for the community and stand up for everyone within the community.